So everything that we're going to go through is we're going to cover off what the new updates are really focusing on when it comes to healthcare waste management within dental, because there have been some changes came into effect in 2022, and we are starting to see the changes come through into mainstream primary care dentistry. So hopefully at the end of this presentation, you'll have some understanding in regards to what it kind of means to us when we manage our waste. So Joan has obviously done an introduction, but I did have a slide just with a brief introduction of who I was as well. So I will skip through this. But as Joan said, yeah, 18 years in dentistry, primarily worked with manufacturers within different various markets, but also focused within infection prevention and control. For 10 years, I worked for Henry Schein Dental up until 2020. And sort of 14 years, coming on 15 years now, it's focused on infection prevention and control, working with the guidance documents within the UK and Republic of Ireland as well, and also working with European guidance documents all around decontamination and how we reprocess those reusable dental instruments. So I set up Decompete in 2020, November 2020, with my wife. So my wife does Bex does all of the social media. I do not get involved with the social media. She just won't let me get involved with it. And to be completely honest, I do not have the creativity. If I put something on social media, I've normally got a message from her quite quickly telling me to take it down. So I just don't do it now. So she does all of our all of Decompete social media. We are big supporters of dental nurses, massive supporters of dental nurses. I think dental nurses, you guys do a phenomenal job, sometimes underrated with the work that you do. So we are huge supporters of that. And everything that we do within Decompete is there to try and kind of aid and to help sort of navigate not only the various guidance, but also be there as a source of information should you require various pieces of information. As Joan said as well, I have had a monthly column with Dentistry Online for 3.5 years now, and all of the articles, all hints, tips, new updates, everything that comes out. So there's a catalogue of past articles that I've written for Dentistry Online. And I've been married for 12 years, and I've got 2 daughters, an 8-year-old and a 5-year-old, which my wife has taken to inflate and play this afternoon. So they are having 2 hours of jumping around on a giant bouncy castle. So they're having fun. So it's nice and quiet in the house, apart from the dog, who may come and bark at some point, but hopefully she'll be all right. Because she's 14, going deaf, and doesn't understand what's going on around her. So hopefully she'll be all right. So what we're going to cover off is focus off within everything to do with healthcare waste is within the UK guidance documents when we look at decontamination, infection prevention and control. So the UK is quite unique in regards to the fact that we can't just have one document. We have 4 different, if you take the Republic of Ireland, we've actually got 7 different guidance documents. They're all trying to achieve the same thing. And healthcare waste feeds into all of these documents as well, and the safe management of that healthcare waste, because it is all about trying to maintain your safety as well as obviously patient safety. But when it comes to healthcare waste, it's also trying to maintain the environment safety. So we don't want anything getting out within our healthcare waste that is potentially harmful to the environment and humans and other humans. So these documents do all talk about it. And when we look at HTMs, particular, if we look at England and Wales and Northern Ireland, and some of these do feed into Scotland as well, although Scotland very much works towards slightly different guidance documents. But health technical memorandums, we're not just working with one health technical memorandum. We are working with a bank of these, and a bank of these focused on healthcare, not just dentistry, everything to do with healthcare, of which dentistry is an element of that. So we have 00, which focuses on all of the policies and the procedures that we need to have in place within our practices. And obviously everything around the policy makes a procedure. The outcome of a policy is the procedure that we work for, that we work towards, which is based around the policy that we have within the practice. So that's 00. The 01 element is decontamination, and it's a very broad element. The 05 part of that is the primary care dental element. There are 0101, 0102. There's various different 01s, all looking at various different elements, from surgical to endoscopy to all sorts of elements. The 05 part of that is specifically primary care. You've then got 02, which focuses on medical gases. 03, which focuses on heating and ventilation systems. 04, which focuses on water, which is where we get the whole Legionella risk assessments and so forth. 05 looks at fire safety. 06 looks at electrical services. 07, which is what we're going to focus on today, looks after the environment and sustainability. The 01 element is the healthcare waste. 08 focuses on specialist services. And all of these indirectly do feed into the UK's decon documents that we're working with, the guidance documents that we're working with, because in essence, we are working with medical gases, heating, water systems, fire safety, everything that helps our practice run from day to day. 0701, as I said, is all around the safe and sustainable management of our healthcare waste. Now, this was updated in 2022. So prior to that, we were working to a 2013 document. 0105, SDCEP, WHTM 0105 all make reference to healthcare waste, normally within the appendices. So they are making reference to the color coding that we're working with. And we're going to come on to the color coding, the national color coding that we work with further on in the presentation. The new update is really focused around more sustainability. There's a huge push towards sustainability. This isn't just a dental thing. This isn't even just a healthcare thing. This is a global initiative. How can we, as a human race, be more sustainable? We discard a lot of waste that is potentially harmful to the environment. There's a big move towards less plastic, which isn't a new thing. It's been in existence since 1975, believe it or not, that we've wanted to move towards less plastic. It's really only in probably the last 5 or 6 years that we've seen a significant move towards biodegradable products and so forth within dentistry. And your manufacturers of the products that you're using within our industry are moving towards trying to have less plastic within their packaging. It's also bringing it in line with DEFRA's plans to have a green future, this 25-year plan they have to include us into a green future, and also the NHS's plan on delivering a net zero national health service, so that the aim is that the health service will generate zero carbon footprint. There's a big push towards what we are referring to as offensive waste collection, which I will come on to. And then what we'll see as we go through a lot of this is this program that they're rolling out, which is called a 20-20-60 program. Now, what this program means is at the moment within your settings, 20% of your high temperature incineration waste will be reduced. So these are your yellow containers, and we'll come on to them in a sec. 20% of your current waste that is being sent away for alternative treatment will be reduced. And that waste is indirectly your current clinical waste, those orange bags, they are all sent for alternative treatment, and we'll come on to them in a sec. And then this new classification, which is it's not new element, but it is a relatively new thing within dentistry, called offensive waste, that's going to increase by 60%. Some healthcare waste providers have actually increased that even more, but I'll come on to that in a second. And the reason why that waste is being increased by 60% is the vast majority of that waste can be used for alternative energy or can be used for recycling. So, so there's a big whole sustainability piece, and the knock-on effect of that is that we can use it as an alternative energy source, or we can use it as a recycling method to be able to produce more packaging for future products and so forth. So that's the program that we're going to talk about as we go through this presentation, this whole 20-20-60 split. What does it mean? What does it mean for dentistry? So ultimately, what we're going to see is this whole thing called a waste hierarchy. Now, at the moment, the large majority of our waste that we have within our practice will end up in a clinical waste bag. So within your surgeries, you'd have clinical waste bags. Whether the products have been used, doesn't matter what patient the products have been used for, they will all go into the clinical waste bags. Any domestic waste, any recycling, we might have mixed packaging, will get thrown away. We tend to have a sort of our thought is that we will just throw it away into municipal waste. We don't necessarily pay a big emphasis into recycling items, into repurposing items, and so forth. What the new update is trying to do is it's trying to change our mindset in the way we are getting rid of our healthcare waste and making us really answer a couple of questions to ourselves, i.e., do we need to get rid of something, or can we reuse it, or can we repurpose it within the practice in some way? And we'll come on to these in a sec. Ultimately, what it's trying to, this whole waste hierarchy is trying to achieve is that throwing an item away is our ultimate last resort. So healthcare as an industry generates a lot of waste. We throw away a lot of items. We have a lot of PPEs, for example, that is thrown away. A lot of pouches are thrown away post-treatment. How can we as an industry reduce the amount of waste that we are throwing away? And that's what this waste hierarchy looks at. So it's a funneling method. A bit similar to what we do at home, you know, when we have our waste at home. Now, I don't know about you guys, but I've got within our house, we have 5 different bins at our house. So we've got our black bin, which is our municipal waste. That's the color coded for the municipal waste, of which we put all of our non-recycled items in there, general household waste. We then have a blue bin, which is our plastics and recyclable tins and so forth. We have a red bin, which is our cardboard items, things like that, the paper items that can be recycled. We have a green bin, which is all of our garden waste. And then we have a little grey bin, which is for our food waste. And at the local councils, and I'm sure your local councils will do this as well, that they push us to be able to recycle more. And that's exactly what we're looking at when it comes to the way we get rid of our waste within dentistry as well. How can we be more sustainable? That waste hierarchy is nothing new. It was first introduced in 75, and the reason why it was introduced was trying to reduce the amount of waste that we dispose of or that ends up in landfill, and trying to make us look at the waste that we are generating, and rather than sending waste down to landfill, we send waste to areas that could either be recycling or could be alternative energy generation. We are, as a planet, exhausting our natural resources. So trying to come up with new alternative energy sources is a key element not just within the UK, it's a global initiative. So everything that we can do to try to help facilitate that is a good thing. And that's what 0701 is now asking us to do within dentistry. Look at our packaging that we get our supplies in. Can the packaging be recycled? If it can be recycled, then it shouldn't be ending up in municipal waste bins. It can go to recycling, and we'll come on to that in a sec. There's also this that you may or may not have seen. There's also the possibility that the UK is going to ban wet wipes. When I say ban wet wipes, I mean ban wet wipes that contain plastic. So a lot of the wipes that we use for cleaning and disinfecting our surfaces will, unbeknown to us, have a small element of plastic in them. And they have plastic in them because it gives the wipe rigidity and it helps maintain the wipe while it's in a solution. The last thing you want is to be able to pull that wipe out and it just disintegrate in your hand while you're trying to use it. So manufacturers and the manufacturing process put a small amount of plastic in it to help keep its shape, to help keep it rigid. Unfortunately, and we see it predominantly with baby wipes, with wet wipes, for example, they end up down the toilet. And then we get the big fat balls in the sewers that you may have seen before, which are quite disgusting. And of course, the wipe itself can degrade over time. But of course, plastic doesn't degrade. And it's that plastic that is then left. You could put an item down, come back to it in 500 years' time, and the plastic will be there. The rest of the wipe would have gone, but the plastic will still be there. It doesn't degrade. So DEFRA were in consultation up until the 26th of November last year. They had a 6-week consultation period on the proposed banning of wipes within the UK. Now, what will that mean for us as an industry, and what will that mean for us using wipes at the moment? If the ban comes into play, which I think it will at some point this year, I think it will come into play. It's a natural progression. We will be moved or forced to have to use either an alternative wipe, which will be a biodegradable wipe, or a wipe that doesn't contain plastic, or we would revert to sprays. And I see a lot of clinical research, and there is a lot of clinical research out there to the advocation of microfiber cloths within dentistry, because microfiber technology has phenomenal pickup of debris from surfaces, because it utilizes capillary action and the way that the microfibers are made. They are amazing at holding debris and not redepositing debris back onto surfaces. So their application within dentistry has a lot of weight going towards it. And the beauty about microfiber technology is that it's completely reusable, because when it becomes visibly dirty, you would simply wash it at the hottest temperature possible, and then you would reuse it. So there's a lot of research out there currently undertaken within England that is backing up the use of microfiber technology. So there is a lot of alternatives, but this is something to bear in mind. And funnily enough, this came into play shortly after the new update of 0701, and it's this big push towards no plastic. So what does this waste hierarchy look like? What do we need to be looking at? So the whole things we need to be analysing is prevention by repurposing. So when we talk about prevention, we're talking about ultimately landfill, this getting rid of it. Let's try to prevent it to start with. So before we even get to the point of discarding an item, we need to actually dispose of. We need to actually decide, do we need to dispose of it? Do we need to buy that item again? Or could it be repurposed somewhere else within the practice? If we have an instrument that is slightly damaged, does it need to be thrown away? Or could we reuse it somewhere? Could we reuse it for training? Could it be donated to charity, so forth? Or ultimately, that throwing away of that item needed to be the last resort for us. Recycling or energy generation, the item that we throw away within our clinical bags or within our municipal waste, can it actually be recycled? Have we got appropriate segregation methods within our practice? Can those items be used for alternative energy sources? And this is, again, what needs to be focused on within the industry. The document also talks about something called the 5 R's, which is very similar to the waste hierarchy, but obviously focusing, the 5 R's focuses on an individual product. So it looks at reducing, reusing, reprocessing, repurposing, or recycling. So reduce, can we reduce the amount of packaging that is used or purchased? So this is something that your manufacturers will be working with. How can they reduce the amount of packaging on an item that they're delivering to you? Very similar, I don't know about, Amazon. I said earlier on about Amazon. My wife got shares in Amazon. We're always buying stuff from Amazon. And sometimes I have to be honest, the packaging that Amazon send an item in is ludicrous. They might send a really small item in a whopping great big box with a load of packaging inside it. Yeah. I don't know what they're quite thinking of. It's not going to be damaged in transit. Now, fortunately, it's cardboard, and yes, it can be recycled, but it's completely pointless the way that they've packaged it. There are far better ways that they could package that to send it on. And that's what this whole reduce element looks at. Reuse, can the item before throwing away be reused? If we get our consumable lines in practice and they deliver them in a big box, before the box is broken down or thrown away, could we reuse it somewhere? If we've got a load of files, could we reuse it to store the files that will then go up in the loft or out in the garage or something like that, rather than throwing it away? If we have a redundant piece of equipment, we've got an old ultrasonic bath, for example, do we need to throw that ultrasonic bath away, or could it be reused somewhere else within the practice? Could it be, if it's working still, could it be donated to a charity rather than throwing it away? All about what we're trying to get out of this is throwing away needs to be the last resort for us. Could we reprocess? If we've got an item that's become redundant, can it be reprocessed throughout the practice and then be reused? Or must it be thrown away, particularly, I suppose, if it's a single-use item? Go from reprocess, can we repurpose it? Can we repurpose something back through the practice? Or are recycling items, for example, being placed in general waste? So are they going through the right and the correct waste channels within our practice? And then obviously recycle. Does it have the recycling symbols on the packaging? And are we recycling the items as much as we possibly can? So the document talks about these 5 R's, and it's just about the way of now just reassessing those individual items that we're getting rid of. Healthcare waste, all of our waste is called healthcare waste, and that can be clinical waste, offensive waste, and also other non-clinical waste and resources. Generally, what we'll see within the setting, within dentistry, is there will be 2 distinct waste streams that we're now having. Non-hazardous waste and then hazardous waste. So your non-hazardous waste, and this is the bit, when I come on to it, this is the bit that we've got to kind of get a head around. Non-hazardous waste can include any rubbish or recycling that doesn't cause any harm to humans or the environment. Examples of this is waste that is being produced from a treatment of a non-infectious patient and or not contaminated with infectious bodily fluid. As IPC, we are always taught to treat every patient as potentially infectious. when they come into and they sit in the chair. Every patient coming in is a potential carrier of something, whether they know about it or they don't know about it. And that's what we're taught. Now, that is from an infection prevention and control perspective, because what we don't want to do is start neglecting our personal protective equipment on the basis that a patient comes in, they haven't identified that they don't have any, they've identified on their medical history that they don't have any infection. Their family history doesn't give us any reason to think that they have any infection. The procedure that we're doing might just be a checkup, doesn't indicate that they've got any infection. And what we don't want from an IPC perspective is, based on those things, for us to neglect our PPE. We're still wearing our PPE regardless. So our face mask, our visor or goggles, our gloves and our scrubs, we are still taking the precautions. When it comes to healthcare waste management, it is slightly different, because the dealing of that healthcare waste is not the practice that's dealing with it. It's the healthcare waste carrier that is then dealing with that waste. And 0701 also helps with the management that they're having to do as well. So what this all means, this whole waste, non-treated, non-hazardous element means, is if a patient comes in and they fill in the medical history and they indicate that they don't have any infection that they're aware of, and nothing's changed on their medical history, they sit in the chair, they are going through a routine checkup. The clinician, after the procedure, has no reasoning to think otherwise that they have any infection or any infectious bodily fluid. The waste generated from that then, so all of the PPE, any of the materials that we use that could have bodily fluid on them, is then treated as a non-hazardous waste. And as such, it goes into the non-hazardous waste stream, which is the new tiger bags that we're seeing, the yellow and black tiger bags, or offensive waste it's classed as. Hazardous waste is the secondary waste stream, and hazardous waste is any waste that is harmful to the environment or human health. So this classification of waste is everything that has been produced post-treatment of an infectious patient or a suspected infectious patient, and it's also contaminated with bodily fluid, medicines, chemicals, things like that. So a patient comes in, they might indicate on their medical history that they don't have any infection that they're aware of. They sit in the chair, start the treatment, it transpires that they have an abscess, for example. The instruments are then going to be infected with infectious bodily fluid. So although the patient has indicated they don't have an infection, which would indicate that the waste goes into the offensive element, because it's been treated with infectious bodily fluid, that all of that waste generated then goes into the hazardous waste stream, which is our existing clinical bags, our orange sacks. If a patient comes in that indicates on the medical history that they have an infection, then everything goes into the clinical bags. The only time that waste doesn't go into the new with the old orange sacks is if they are sitting within that non-hazardous waste stream. So what these two waste streams mean for practices now is you're having to ascertain each individual patient on an individual basis. And you won't know the full extent of where that waste goes until the procedure is over. Because even if the patient has indicated they don't have any infection, you may identify infectious bodily fluid throughout the procedure, which then changes the way that waste is then disposed of. The national colour coding, as we see it, still remains the same, however. We still have our orange bags, which is for clinical infectious hazardous waste. We still have our yellow, although you may or may not have seen the waste boxes now, these sharps boxes now are this hideous mustard yellow colour. They're not a nice bright yellow, but they're all being made of recycled material now, hence the colour change, the slight colour change in them. You've got your black, which is a mixed municipal waste. You've got white, which is the dental and toxic, non-hazardous. You've got your yellow and black, which is this offensive waste, the non-hazardous waste, tiger bags. You've got your blue, which is medicinal. You've got your clear, lateral flow, but also clear can be used for recycled items. Purple, cytotoxic. And then your red, which is for anatomical, body parts. Anything that's got body, organs, things like that will go into the red. And when we look at the healthcare waste that we're generating, there's multiple streams that some of this waste could go in. So a patient bib used on a patient post-treatment, we have no indication that they've got an infection. We have no suspect that they even have an infection. That patient bib goes into the offensive waste stream, would go into the new tiger bags. Sharps, LAs, things like that, classed as hazardous, highly infectious, still goes into the sharps bins. Teeth, extracted teeth from a patient that we don't suspect as having an infection, and they have also marked on their medical history that they don't have an infection. If the tooth has got no amalgam in it, the tooth goes into the offensive waste stream, the tiger bags. If the tooth has got amalgam in it, got two options: either put the whole tooth into the amalgam pot, or if you can remove the amalgam, take the amalgam out, put the amalgam in the amalgam pot, and put the tooth into the offensive waste stream. If the patient is being treated and they have got an infection, then obviously it still goes down that clinical, that orange bag waste stream. Same with impression material, same with tissues, and we'll come on to gypsum study models in a sec. And then your wipes and your sprays and your face masks, again, these will be navigated down the two waste streams. So orange, any of these materials that have been used post an infectious patient still go into orange. Any of these that have been used post a non-infectious patient or suspected of no infection whatsoever goes into the offensive waste, goes into the tiger bags. And this is where largely we're going to see the tiger bags increase rather than the offensive, the clinical bags. And I'll come on to the advantages of this for the practices in a sec. So if we look at yellow still stays. Okay, these are highly infectious. A change in line with the 2022 as well, with sharps bins in particular, was previously, if you had a sharps bin in your practice that wasn't used, so it hadn't been used at all, you had to return it after 3 months. That's now changed. You don't need to do that any longer. That got taken out. That was a nice guidance, and that got taken out in 2022. So if you've got sharps bins within your practice that have not been used, you don't have to send them back after 3 months. They just remain in the practice, and then when you get to use them, you use them. The moment they are 3/4 full, they're closed up, and they must be removed from the practice within a month of them being full. You might see blue and yellow bins coming through. These are a hybrid bin between the regulated highly infectious bin and also the medicinal bin. So these bins will take, along with your sharp items, they will also take your blister packs, your inhaler cartridges, your medicines, your expired medicinal items. Some waste carriers have gone for them, some waste carriers haven't. A lot of waste carriers are still typically sticking with the solid blue bin. And those solid blue bins are obviously for tablet containers, blister packs, liquids in bottles, inhaler cartridges, droplet bottles, and so forth. Your sharps bins within your practice should ideally be wall mounted. By keeping them wall mounted, it reduces the risk of them potentially being knocked over, particularly if they're on a surface. There may be a tendency that they could be knocked, or when you're putting items in it, it could be knocked over. So by having them wall mounted, there's no way that they can be knocked over. Whenever we load anything within a sharps bin, it's important that your PPE is being worn. And by every sharps bin within your practice, it's important that you have the inoculation injury poster next to those sharps bins as well. You then got your orange. Now, orange bags, clinical infectious waste bags. Currently, with those bags, they're quite expensive to get rid of. Also, by having an orange bag within the practice, you also have to have a duty of care with your waste carrier, which falls into your duty of care audit that needs to be carried out as well. And on the back of that, you also, part of that duty of care, have to receive a consignment note from your waste carrier. And it's those consignment notes that we then keep for the 3-year duration, so that we've got a record of exactly where that waste has gone. And that consignment note is purely because we're dealing with infectious waste. So you want to be sure that that waste carrier, once they take your waste, that they are getting rid of it in the correct manner. Now, the reason why these are quite expensive, so currently, as we said, they are infectious, it's clinical infectious waste, but the items that could be in this bag may not be treated or may not be exposed to infectious materials or infectious bodily fluid, because they could be treated on a patient that doesn't have an infection, particularly if it's a checkup or something like that. So we're throwing away a whole mixed bag. The problem with it is that bag has to go to an alternative treatment plant. And that alternative treatment plant is a way of rendering all of the contents of that bag safe, because all of the contents of that bag are assumed to be hazardous to the environment and human health. And that has to be in a licensed facility. The orange bags can also be incinerated as well. They can be suitably incinerated. Now, each of those bags, your waste carrier will charge you for a clinical bag between £10 and £16 to remove that bag, because of the whole treatment it needs to go through. So it's not an inexpensive thing. It's quite an expensive way of getting that bag. Tiger bags, which we'll come on to, are a much more cost-effective way of getting rid of the bags. Your orange bags also need to be obviously placed in a hands-free container, so there's no way you've got minimizing that cross-infection, that cross-contamination. And your clinical bags, again, part of this whole duty of care, must have your practice postcode clearly marked on them. Tiger bags, the newly one. Your practice may or may not have seen these started to come through. Certainly the waste carriers are starting to implement these across up and down the country. So those tiger bags, as we said, they're offensive waste. Tiger bags typically have always been used in the sanitary towel bins within the toilets. So you've got your sanitary towels going into them. We don't know if those sanitary towels are infected or non-infectious, but they go in, they're classed as offensive. It's offensive or only, not necessarily infectious. It's just an offensive waste. So those bags will be normally produced, will be sent to a licensed facility. They are normally automated, so there's no human interaction with these bags at all. The bags are collected, the bags are placed onto the trucks, they're sent to the licensed facility, and it's a fully automated procedure that happens at the licensed facility. All of the waste is segregated. Certain elements of the waste that can be recycled are sent for recycling. Large proportions of the waste that can be used for alternative energy sources are sent for alternative energy sources, and a small proportion that either can't be recycled or can't be used for alternative energy source is incinerated. Ultimately, the vast majority of the waste generated within these tiger bags is used for some form of recycling energy element. So it's more sustainable, and also your waste carriers are getting some kind of money kickback for it because it's being used for these alternative sources. The waste that goes into this is your non-infectious personal protective equipment, your non-infectious dressings, non-infectious sanitary wear, for example, sanitary waste, okay? Non-infectious tray liners and materials that have used will go into the offensive waste stream. Items that can't go into the offensive waste stream are infectious waste, medicines and sharps, and general and recycling waste wouldn't go into the tiger bags. So your clinics may or will now have two bins. You'd have an orange bin and you'd have a tiger bin. Now, when it comes to these two, when they're being implemented, there have been some waste carriers that have categorically said to the practice, we are no longer delivering you orange bags. All of your waste now goes into the offensive waste bag, the tiger bag. If you want an orange bag, then the charge is between 10 to 16 pounds is typically what I'm seeing with the waste carriers. But the large majority they want is tiger bags. Now, the benefit also from a practice is because it's offensive waste, because it's non-hazardous, there's no consignment note required for the collection of these bags. So hopefully, I haven't seen it at the moment, but the hope is that the cost benefit would be parted back onto the practice. So indirectly, there will be a cost benefit to utilizing and using the new tiger bags. You've then got your white, which is for your non-hazardous gypsum, your amalgam pots. If you've got amalgam separation on your dirty sink or on a sink within your practice, then you'll have the green amalgam, which sits under the sink, sits in the water on the waste line. And what happens, they have a series of fins in them. The water goes through the fins, and those fins will filter out minute particles of amalgam, so that the water that goes down the waste is pure water with no amalgam left in it. You've got your black, which is a mixed municipal, which is minimum treatment. Normally it's disposed of via landfill. Any items that can't be recycled, that can't go through alternative energy sources or anything like that, would go into the black sacks, and that could be sandwich wrappers, flowers, things like that would go into there. What we need to do, certainly with those orange bags that we have, and to some extent we do still want to do it with the tiger bags, is we want to make sure that we have a secure way of tying those bags up. So our clinical bags still need to have the UN specification bags for practices that are still utilizing clinical bags. And you would still need to obviously put your practice postcode on there. So there's an element of traceability. It is important that we carry out the swan neck method for tying those bags up. Now, whether this be the offensive bags or whether it be the orange bags, they should all be tied up this way. And the reason why we tie them this way is that it produces or provides a handle for carrying of the bag. And it also enables us not to overfill the bag, because all of the bags that we have will have a weight limit on them. Depending on the bag, it'll range from 5 kilos to 8 kilos. So there is a tendency sometimes that we could overfill the bag, and that makes it, from a health and safety perspective, very difficult to carry a bag. But also there may be a tendency that the bag could split and open up. And I've seen orange bags in particular, not so much the thick orange bags that are out there, but certainly the thinner orange bags where they have been split from an overloading element. Also, what can happen is you can only tie it so much. So there might be a tendency that if we've overfilled and we tie it just with a simple knot, that the knot can come undone, and it doesn't really provide a safe element to be able to carry the bag. So we want to look at the swan neck. And this is simply twist a sufficient amount of bag at the end, neck it over, so you've got a swan neck, and then we use a zip tie, because zip ties are the best way at securing any of the bags to secure the base of that bag. What that then means, if there's anything in that bag, it's got no way of traveling back out, of coming back out of that bag, because it will not be able to travel down that swan neck. They then need to be secured in a locked box somewhere. And what will happen, your offensive waste would go into your secure bins as well. Now, the bins that you have, whether they be outside the practice, need to be locked. If you've got one of these wheelie bins, it needs to be chained to a wall, so there's no way of it moving or it being carted away. And if you've got a cupboard rather than one of these bins, it's important that the cupboard is protected from the weather, and it's protected from any rodents or anything like that. So there's no way that rodents can get in and start going through the bags. Some study models, they're not usually infectious. However, the gypsum himself and the study models themselves, they can produce hydrogen sulfide gas, so they can't be disposed of in landfill. Easiest way for these is just dispose of the small parts and then dispose of them in the orange bags. Or if you've got study models, you might want to give the study model to your patients, or however you work with it. I see most practices will have a bank of study models stored up. But we just need to make sure that we're getting rid of those in the correct manner as well. You can also look at a waste segregation poster to back up with this, which are quite useful. I can send you a copy of this one I put together if you want. I'll send it through, and then Pam and the team can send it out to everybody if you want it. These are just PDF. Laminate it, print it off and laminate it, and then it'll just take you through the different waste streams. You can also look at waste bin stickers as well, which could be quite handy, which we produced. And these will just stick on the bin, and it's a way of identifying what can go in and what can't go in. Because unfortunately, we are only human. We got a lot of things to think about in the day. We don't want something else to think about. And anything we can have that can make it easy, so we're not having to necessarily think about something too much, because we've got a million other things to think about, and make it easy. So there's those. Oh, these are little A5 laminated washable stickers. Ultimately, some guidance what we need to look at with this new 0701 is that we need to ultimately make some considerations before disposing of an item. With last resort, as we said at the start, is disposing of it. Before disposing of an item within the infectious waste stream, so within that orange waste stream, we just also need to consider, is the item actually dangerous, or is it just unpleasant? If when you treated a patient, if you are categorically assured that there is no way this patient has an infection, and you have no reason to suspect that they have an infection, then it is the offensive waste stream, in which case that's the recycling and the energy generation. If at the end of a treatment you ascertain that the patient has indicated they don't have an infection, but you're still not 100% sure if they do or not, there's questions, there's doubts in your mind as to whether the material is infectious, then always you could revert back to the orange bags if you're not 100% sure. Sharps are definitely not considered offensive waste, and they can pierce the bag, and they must be placed in the sharps bins. Sharps bins are no longer subjective to the 3-month turnaround if they're not used within the practice. If they're not used, you can keep them in the practice for as long as you like until you're ready to use it. Obviously, from your clinical side, your orange bags, it's important that you have got duty of care audits and pre-acceptance audits. Tiger bags are not subjected to the pre-acceptance audits or the duty of care audits because they are non-hazardous. So that's the benefit, and hopefully those cost savings will come through. The biggest mind change for us is all about treating a patient as if they're infectious, but then getting rid of the waste as if they're not infectious. That's the biggest thing. All we need to remember and bear in mind is we are treating every patient as infectious from a personal protective equipment standpoint. We do not want to negate in our personal protective equipment just because the patient has indicated they don't have an infection. So that still stays the same. When it comes to the waste element, we are not dealing with the waste. Our waste carriers are dealing with that waste. And they are the ones that will indicate to you the items they want to go into that waste streams. As I said as well, some carriers have taken the even the thinking about it out of the equation and just categorically said, we're no longer delivering you orange bags. We are only going to be delivering you tiger bags. And they are then dealing with that waste at the end of the day. So this is what we're going to be looking at, okay? Implementing your sharps are going to be a reduction of 20%, or your yellow bins will be a reduction of 20%. Your orange will be a reduction of 20%. Your tiger will increase by 60%. Now, this isn't a one-size-fits-all scenario. Not all practices are going to meet these numbers. Some will be higher, some will be lower. But it's about working and analysing our waste and making sure we're getting rid of it within the right streams. A couple of things I just wanted to touch on just briefly, just for BADM members, is that we've got the Testing and Validation Guidance Handbook. You guys get 30% off this. Have a look at it. We put this together on the basis of trying to help you navigate if a test fails of an ultrasonic, for example. There are some steps you can do to hopefully rectify that test. Likewise with autoclaves, likewise with washer disinfectors. There's a lot of guidance in here in terms of what the national guidance are telling us to do. There's outlines into what tests we need to do. What does a test mean? What is a steam penetration test? What is a Bowie Dick? What is the, what are these tests? And also the correct procedures in terms of manual cleaning, RO, hot and cold water testing as well, and Legionella in particular. So it's a real go-to, just handy guide. And also a couple of things that the business that we offer is a range of logbooks, decon training days, decon lead training packages, and so forth. And you guys all get 15% discount off all of those as well. So there are some things for you.
The British Association of Dental Nurses, proudly supporting dental nurses since 1940.